Welcome everyone to our next session on stage 1, Finding Help to Feel Far From Alone. This session will discuss the importance of social connection as a health-related social need, and we'll explore how our partnership with the Far From Alone campaign leverages Find Help to personalize resources for those experiencing loneliness and other social health issues. I'm pleased to welcome our speakers for today's session. First up, Katie Holcomb, who serves as Population Health Strategy Lead at Humana, one of our coalition's valued partners and steering committee members. Katie oversees external communications and supports strategic national partnerships designed to address health-related social needs and improve health equity. Next up, we have Benita Koyton, a manager in Humana's care management program and leads a team of social service professionals working to ensure members are connected with resources to meet their identified needs. She is a licensed clinical social worker with 30 years experience in the field of human services. Great to have you, Benita. And then finally, we have Janie Ahner, an account executive at Find Help, formerly known as Aunt Bertha. Her specific work today includes enhancing the social care strategy of payers and healthcare providers through the use of social care referrals, reimbursement strategies, and analytics. Please join me in welcoming Katie, Benita, and Janie to the Action Forum. Thanks, everyone.
Awesome. Well, thank you so much, Eddie. I'm Katie Holcomb from Humana's Health Equity and Community Engagement team, and I'm super excited to host our panelists today to talk about finding help when far from alone, which is a bit of a play on words there, since we have with us today Janie Ahner from Find Help and myself and Benita Koyton from Humana to represent Humana's Far From Alone campaign. So just a little background on why we're here today. So many of us know that most health outcomes happen outside the doctor's office: access to food, transportation, housing, and of course, social connection. And they all have big impacts on physical health. So how do we encourage doctors, nurses, care managers, and social workers to make social health a key part of a patient's experience in the doctor's office and other settings where they're interacting with patients? So we're getting better in this space, and it's a really good thing that we'll have a proposed new HEDIS measure on social connection in progress from the NCQA that Adriana talked about yesterday. But still a lot of work to be done to get more clinicians engaged in social needs screenings and interventions. So that's why Humana is excited to partner with Find Help on the Humana Community Navigator tool and work with clinicians to help people with unmet social needs like loneliness and offer them resources like Far From Alone. So our goal for this session is to empower you as a physician, nurse, care manager, social worker, or other clinician, or anyone else interacting with people in need, to know when and how to what we call social prescribe using the Humana Community Navigator powered by Find Help, and see how it's making a difference with our members. And because this tool is available to anyone, it's not just for Humana members, this session is also for anyone looking for help around social health needs, including loneliness. Next slide, please. So Janie, I'd love to kick off with you from Find Help. Can you tell us what is the Humana Community Navigator and how does it work?
Thanks, Katie. I'm excited to be here today to represent Find Help in the work that we do with Humana and Humana Community Navigator. Formerly known as Aunt Bertha, Find Help's mission is to connect all people seeking help and the programs that serve them with dignity and ease. We do this by a compliant and high-trust certified social care resource directory and fully functioning closed-loop referral system that's designed to be read at a 5th grade reading level and is translatable into over 100 languages. Our platform houses over 600,000 available community-based organization programs, all managed and maintained through our in-house network curation team. Our open network means any user on any Find Help platform, including our free site, findhelp.org, or the Humana Community Navigator, can access resources that serve their zip code. Find Help has a seeker-centric privacy approach, a part of which is our per-referral consent, ensuring that those seeking support through a Find Help site are always aware of where their information is going and who is able to access it. The Find Help platform, including Humana Community Navigator, is completely free to community-based organizations who have access to a set of tools that allow them to maintain program listings, respond to electronic referrals, review analytics around their programs, and much more. Our in-house community engagement team onboards, trains, and supports community-based organizations who choose to use our tools, all at no cost to those organizations. Our customers can also partner with our in-house community engagement team to build sustainable, trusted, and sometimes incentivized relationships with community-based organizations. Using our platform, our customers and partners like Humana through Humana's Community Navigator are able to better care for members and patients by connecting them with and referring them to social care resources to support whole person and holistic care. This includes SDOH needs not typically covered through traditional medical settings like food, housing, transportation, and more. There's so much more that I could get into today that findhelp supports through our platform and that Humana Community Navigator partners with us on, including different types of integrations, Medicaid 1115 waivers, fulfillment of social goods and services, interoperability initiatives like the Gravity Project. But ultimately, what it comes down to is our goal is to continue to support our customers and their members and their patients in connecting those folks to social care services with dignity and ease.
Thanks, Janie. So I want everyone to imagine a real life scenario here. You can go on to the next slide, please. Let's imagine you're a physician and one of your patients comes into your office with a medical concern, could be shortness of breath or high blood pressure. They may actually have some barriers that you're not aware of, like loneliness, that are bringing them to your office in the first place. A study last year revealed that 77% of adults classified as having fair or poor physical health are experiencing loneliness. But not every patient is going to tell their doctor, I'm lonely, hey, I need help. So what are some signals and ways physicians and other clinicians can identify people who are lonely or in need of social connection?
That's a great question. I want to start by noting that I am not a medical provider, but my career has been focused on working with medical providers to utilize technology in their day-to-day workflows. So in my experience, there are a few different ways to help folks and become aware of the situations that they may be facing at home. Because you're right, Katie, a lot of people are uncomfortable saying they need help, and some of them are just not talking to their healthcare providers about their at-home needs. The most efficient way of understanding the breadth of social needs a member or patient may be facing is by incorporating a social care needs screening or assessment tool into your day-to-day patient-facing workflows. Prepare or HSRN are common standard assessments, but many organizations that we work with at findhelp have their own version of a social needs screener or assessment that they utilize on a daily basis. To make things even easier for your providers, consider working with your technical team on integrating those screeners or assessments directly into tools that are already in regular use, like your EHR or your care management system. Many findhelp customers take advantage of our built-in social needs assessments, and using those tools, users are able to identify social needs and are subsequently suggested a list of free or reduced cost resources available to help fit those needs for the member patient that they may be working with. The most underrated way of learning more about a member or patient's social needs, in my opinion, is to simply have a conversation with that person. Asking something as simple as, how is it going at home? Do you have a support system? What do you do in your free time? Can really help bring some of those complicated topics into the open. I'm sure we're all familiar with wishing that someone at some point had asked us, how are you? When we were going through something difficult in our lives. And finally, for those more tech-savvy patients or members that you may be working with, encourage them to self-navigate the Humana Community Navigator or findhelp.org for needs they may be uncomfortable discussing in person. For example, I may be fine letting my doctor know that I struggle to find transportation to my medical appointments, but I might be less comfortable admitting that I don't have a social support system at home and I've been experiencing loneliness lately. Using Humana Community Navigator, I have the opportunity as a member or patient to easily search for and connect to resources on my own while maintaining my dignity and privacy.
That's great. Thank you, Janie. Those screenings are so important, along with listening and looking for those other social cues, right? And giving them a way to self-navigate to get help, because as many of us know, there unfortunately still is a bit of a stigma around loneliness. You can go on to the next slide, please. So, Benita, you definitely have experience with listening to patients and being that go-to resource for members when they need help. So can you tell us how care management comes into play and how Humana care managers are doing what many people in our industry call social prescribing using Humana's Community Navigator?
Hi, yes, thank you so much, Katie, and thank you for that information as well, Janie. I would love to share more information, not only on how the care management team assists our members with addressing social determinants of health, but also how we utilize the Humana Community Navigator platform to really improve the way we provide resources as well. So I work as part of the care management program for individuals who are in a special needs plan. And the care managers are a dedicated team of healthcare professionals, both clinical and non clinical, who provide telephonic outreach to our most vulnerable members to ensure barriers, including social isolation or loneliness, are identified and addressed. Now, we reach out to the member to assist in filling in the healthcare treatment gaps by connecting them with those community resources. And the main goal is to really help to anticipate the member's needs and problems while encouraging preventative care and self management. Now, as I mentioned previously, we make telephonic outreach to our members, which puts us at a slight disadvantage because we're not able to pick up on those nonverbal cues that may be present if we were face to face with the individual. However, our care managers are very skilled at motivational interviewing, active listening, and really being able to hear what is not being said. Now, as Janie mentioned, a lot of times the individual may not come out and say, "Hey, you know what? I need help. I'm isolated. I'm lonely." But what we do is, when we're talking to the member, we may inquire about their living situation, family support, community involvement. So we really have to listen out for the cadence, the pitch, the inflection, any pauses that the member may have to kind of let us know whether or not we need to maybe probe a little bit deeper and ask, maybe some more questions. For example, if we ask a member to tell us about, your family support or community involvement, well, we may notice that the member may sigh and say, well, you know what? I'm okay. I don't need any help. And, just listening to their tone or their inflection, that may kind of prompt us to say, hey, you know what? Tell us a little bit more about your situation so that we can provide the best resources and assistance for you. And many times when we reach out to our members, they are aware of what their immediate needs are, but they may not be aware of how to access those resources in the community. And that's where the Humana Community Navigator comes into play. Now, both Katie and Janie mentioned earlier about social prescribing. And basically, what that is connecting people to non clinical community support or resources. And let me just share a few examples. So that could be, for example, providing an individual with a free cell phone, something that we all take for advantage. But the free cell phones, they have data talk and text messaging. So that kind of opens up a new world for the member where, if they did not have internet at home, they now have this free phone that has data on it and they're able to connect to groups virtually. So we can also connect to local community centers if the individual wants to socialize or help them understand how or where to use maybe their silver sneakers to go to the gym and possibly participate in health and wellness activities. Now, our care managers utilize the Humana Community Navigator resources to help member in connecting to those resources, like I said, but we also provide education, guidance, and support. And there are several features within the platform that really do help us to do that for the members. We're able to uh, type in keywords to specifically find what the member is looking for. We're also able to help coordinate those resources by viewing the map and then sharing resources in a way that is most helpful for the member, such as emailing or texting. Now, in addition to the Humana Community Navigator, we do draw upon our existing partnerships, such as Far From Alone and Papa, to help be able to identify other options that we can assist the member to help in feeling far from alone.
That's great. Thanks, Benita. That's such great advice and things to keep in mind as a clinician or a social worker. Next slide, please. So, Benita, I want to wrap on a really positive note and let you share a story on a member that one of our Humana social workers helped with loneliness using the Humana Community Navigator tool. Can you share that success story with us?
Sure, I would love to do so. So, Jane was a 73-year-old female who lived alone. She had multiple chronic conditions and recently had a stroke. She had limited family support and little assistance with finding help to address those social determinants of health. So, in May of 2022, Jane was referred and connected with one of our social workers within the care management program to help identify resources for porch rail, utilities, rent, food stamps, and also reimbursement for hearing aids. Now, the social worker identified that the member had some additional needs as well, and the assistance could not be addressed in just one phone call. But utilizing the Humana Community Navigator, Jane was provided with information on organizations such as Department of Agriculture, Area Agency on Aging, Habitat for Humanity, or Salvation Army, to name a few. But also, the social worker made follow-up calls to make sure that Jane was able to kind of connect with those resources through three-way calls and help her to apply for services that were needed for her. Now, the social worker did build a trusting relationship and establish a rapport by simply being willing to listen. And a lot of times, our members, when we reach out to them, we may be the only voice that they hear. Because if they are isolated or, don't have family support, we won't know that, the individual is struggling with those social determinants of health or not having that support. But over the course of several months, the member had frequent contacts with the social worker, sometimes identifying a new need, but other times just to talk. And there were instances where the social worker helped the member connect to the friendship line as an added source of support. So the member was successful in getting many of her needs met, and she does continue to reach out and connect with us so that we can provide support for her. In closing, I just want to say to healthcare professionals, care managers, to just take the time and reach out to individuals because a lot of times we don't know what their situation is. They're not going to come out and tell us many times that they need help or that they're lonely or isolated, but just picking up the phone and calling them and just seeing how they're doing is, a blessing for them. So thank you.
Thanks, Benita. It's so important. And that's what it's all about, right? I mean, I don't think anyone would be in this industry or here at this conference if they didn't want to make an impact on people's lives and be that friend to people in need. And we have, members that reach out to Humana that simply want to talk. They simply want to have a conversation, to your point. So amazing work that you're doing. And we love hearing all these great stories from you and the social workers and care managers. So thank you, Benita. And I want to thank you and Janie for being here today. And we encourage everyone to visit farfromalone.com to find resources on loneliness. You might have heard me talk about Far From Alone before in past conferences, but it is a public health awareness campaign to address loneliness and social isolation. And it includes a lot of great resources for people to feel more socially connected. And please check out our Humana Community Navigator. Again, it's free, available to anyone at humana.findhelp.com. And with that, I'll turn it back over to Eddie.
Well, thanks so much to Katie, Benita, and Janie for that presentation and sharing with our audience how the Far From Alone campaign leverages tools like Find Help to get those in need connected with resources to help them combat social isolation and loneliness.